Hello, I'm Middlesex County Freeholder Director Ron Rios. Welcome to Spotlight on Middlesex County, one of the best sources for news and updates on all that's happening here in the county. Today we will discuss pancreatic cancer and the steps being taken to defeat this silent killer, such as research, raising awareness, and raising funds. This topic is especially close to my heart. In 1995, I lost my mother to this disease. Her story, along with the stories of many others, inspired the idea for our annual Pancreatic Cancer 5K Walk and Run. The first of the county's annual events was held in 2009 and has grown every year since. This event gives hope to all those living with pancreatic cancer and comfort to all families who have lost someone to the disease. Today we are joined by Dr. Edmund Lattime, a researcher and Associate Director for Education and Training at Rutgers Cancer Institute of New Jersey. Dr. Lattime is also a professor of surgery at Robert Wood Johnson Medical School and is currently exploring new treatments for pancreatic cancer. We are also glad to welcome our county surrogate, Kevin Hoagland. Kevin captained the team for the Pancreatic Walk Run last year in honor of his father, who has since lost his battle with pancreatic cancer. We will discuss their experiences with this disease, new medical developments in treating pancreatic cancer, and Middlesex County's hopes for this year's fundraising event. Welcome, gentlemen, and thank you for being here today on the show. Dr. Lattime, could you explain why pancreatic cancer is such a serious disease and why it's called the silent killer?
It's one of the most lethal cancers that we know of. It is called a silent killer because there are no specific side effects. So, with the reasonable number of patients that are seen, they've already progressed to the point where it has spread from the pancreas and it's inoperable. And
how many people are diagnosed with pancreatic cancer annually?
In the country, about 45,000, with about 40,000 deaths per year. In New Jersey, about 1,400 with over 1,000 deaths.
And who is it most at risk for pancreatic cancer?
There are a range of people at risk. One, African Americans have a higher rate of pancreas cancer. Men have a higher rate of pancreas cancer than women. In addition, risk factors such as diabetes, pancreatitis, smoking is a very strong risk factor for the disease.
And maybe you could explain to our audience, is there anything people can do to prevent or avoid to not get pancreatic cancer?
Again, smoking is a predominant risk factor, as is obesity. It really comes down to having a healthy lifestyle. Eating healthily and the like.
And exercise. Do you think exercise might have something to help avoid it, let's say?
Exercise also fits into that overall healthy lifestyle.
Kevin, you participated in our event last year and in honor of your father. And can you maybe give our audience any kind of advice or family's advice, being that it was you were affected personally by your dad?
Well, from my own personal experience and from the experiences of other friends and family whose parents and even siblings, it's a disease that, as the doctor said, just comes upon you. And there's no symptoms, there's no signs, and it's really just very cruel to the patient and to the family because there is a very short period of time. My dad was diagnosed in February, and he was gone in June. And the pain that he suffered, and I know the pain that other people have suffered, is just horrible, not only for them, but for their families to witness. So, our hope is with the science. Our hope is that we can raise as much money as possible to help the scientists figure out a way to detect this disease so that it can be treatable. And that's what we're doing with this walk and run.
Yeah, and like you said, like when I found out that my mother was diagnosed with cancer, a pancreatic cancer at that, and it just like hits you like a sledgehammer, and you're just, first of all, you're just shocked just about the word, just about the word cancer. And then when it's pancreatic cancer, you know that it's a severe cancer that's tough to deal with, and in a lot of cases, it's so late in the stages already that when the doctors do diagnose it, it's really devastating news, and it's hard to deal with when you see a loved one go through that experience. And then, of course, you just try to give them the best care that you can and listen to what the doctors have to say in trying to make them comfortable and trying to, whatever medication, if there is any, to make sure that you get for them. You brought a team last year to our walk and 5K run. How many people did you have in your team?
Last year we had about 30. We hope to double that this year. And we'll certainly do everything we can to help make this a success. And I hope by people watching this show that they'll join you and everyone else that has participated in the past to come this year and not only enjoy the walk and the run, but to help raise as much money as possible.
And what inspired some of your folks on your team, do you think, to get involved and join your team?
Well, the bottom line is they were there for my father.
Yeah.
My dad was, around New Brunswick all his life. We were fortunate that he almost made 85. So, my family, a lot of our friends, a lot of his colleagues from his law firm, they all wanted to participate in this last year's walk and run to support him. And I think they'll all be back this year, and even more so. We're going to put the word out early and often, and like I said, try to double our numbers.
Yeah, and your father really gave back to the community and in New Brunswick and even in Middlesex County as well. And there was you had a big team there for the first year, which was amazing and encouraging too. This year's event is going to be held in Roosevelt Park on June 11th, and it's going to be around the pond. And we're going to have folks from Robert Wood Johnson Hospital and other folks participating as well. And so you got your team started already for 2016?
I do. We're ready to go. We just need to get the information from the health department that they can log on to, as they did last year, to sign up, and we'll be ready to go.
Well, last year we had 95 runners total, 215 walkers, and 8 virtual walkers participated. You think we could beat that number?
Oh, I think we can, and I think we should. I think that if everyone in Middlesex County who has been affected by this disease, either because a loved one has lost their battle with the disease or because they know someone presently who is dealing with the disease, if they all came out, we would easily double those numbers, because it affects people of all ages and different ethnic groups. So I think if all those families and friends of the people affected would come out and support us, we would more than double those numbers.
And as we talk about it more and more, you hear more and more that someone knows someone or is related to someone that was affected by the disease. And that's what's scary. And Dr. Lattime, how many, or maybe you could tell us, what's the number or the pecking order on funding for pancreatic cancer?
There's a substantial amount of funding from foundations as well as the National Cancer Institute. In addition, pancreatic cancer classifies as a rare disease, and that allows opportunities for additional funding from national sources.
And Kevin, going back to you, what was the atmosphere like at the event last year? Being that that last year I think was your first year that you came.
It was, yeah.
And that you had a team, which we're grateful for. What was the atmosphere? Explain to our audience how the atmosphere was, and who else might have been there that you noticed.
Well, you know, I was surprised that it was really upbeat. Everyone was, you know, excited to be there. So many volunteers, you know, helping to register the people. At the after walk, when everyone got together, I think, although we were doing it for a very good reason, the fact that we were doing it for pancreatic cancer could have got people, you know, down. But really, the event itself lent to a really good spirit, and I think people were excited about the idea that they could somehow contribute to finding a cure for this, for pancreatic cancer. So I think I was surprised that it was an uplifting type of event more than like a downer, and I think that's what the attitude has to be for everyone. Is we go into this with the great hope that what we're going to do on June 11th is going to somehow help the next generation of people who are affected by this disease.
Yeah, and you bring up a good point. It's devastating for us that find someone that we love get pancreatic cancer, that we lose someone, and it's about trying to make a difference, a positive difference, that maybe one day we'll be able to find the cure and treatment for it, and make it a better, make it a lot healthier world for our future generations. Dr. Lattime, the 2015 event raised a total of $30,798, and in the last over the last 7 years, we've raised over about $115,000. Tell the audience exactly what or how you use those funds, whether it be for research or treatment.
The funds that were provided by the walk were critical to both research and our clinical trial. We, in the laboratory, found something unexpected as far as the best way to immunize and activate the immune system to recognize cancers such as pancreas. We then moved rapidly to a first-in-man clinical trial where we were able to take what we learned in the laboratory, bring together the clinical team, the regulatory group, and rapidly translate that into a clinical trial for the first time, actually injecting a vaccine into the pancreas. In order to understand as much as possible about what was happening in that trial, in addition to patient responses, those funds allowed us to use state-of-the-art technologies to take what material was available from biopsies, from blood samples and the like, and look at over 1,000 genetic targets to identify not only what was happening in the immune response to the disease, but also identify new targets for the next generation trial. It's also allowed us to move in two directions. One, towards a new next generation clinical trial, taking advantage of what we learned and treating patients with an earlier stage of the disease. The second is the development of a new mouse model that completely mimics what happens in the patient. So now, before we move back into the clinic, we can better dissect exactly what's happening, again, to give us new targets and places to look.
You mentioned team. How many people are involved in your team in working on this project of trying to find a cure or research for pancreatic cancer?
It's really a comprehensive group. Within the laboratory right now, we have over a dozen people looking at pancreas cancer. When we made the laboratory finding, we brought in, they actually came to talk to us, surgeons, medical oncologists, gastroenterologist that enabled us to inject the vaccine into the tumor. Add to that the large regulatory group that allowed us to obtain National Cancer Institute approval to do the study. This was the first time that anyone had put a virus like this into a pancreas. It was really a very large number of people that came together to make this happen.
Well, that's encouraging of what you're saying on how people are working hard and how they're coming to you to get involved. And that's kudos to yourself and to the Cancer Institute on really working aggressively, trying to find a cure. And I can't thank you enough for that work. We've been hearing about precision medicine in the news, and I understand that there's a clinical trial that's trying to help those specific patients with cancer in those forms of cancer that no longer respond to standard therapy. It's through genomic analysis. Can you tell us about the implications for the patients?
It's really changed the way that we approach disease. As you say, it's initially for patients with rare diseases or diseases that have failed treatment. The prior paradigm had always been to treat the disease based on what it looked like to the pathologist, based on what stage of the disease it was. So it was pancreas cancer at a certain stage. What we've now done, and this is really a movement nationally, and President Obama has gotten behind it, is to take the patient's tumor, take advantage of genetic capabilities now at Rutgers, to sequence the tumor and identify not the kind of tumor it is, but to identify the gene changes that are driving the tumor. We call them driver mutations. So that what happens is we take a biopsy of the tumor, we send it to the laboratory. They look at over 400 genes that have been shown to, if changed or mutated, be able to drive tumors. There's now an increasing number of what we would call targeted therapies that target the specific gene change that we identify through this sequencing. We've also at the Cancer Institute taken it to the next level and incorporated a weekly meeting where every case is discussed, and it's not only discussed by the mutation and the drug, potential drug, which is the paramount thing to do, but also our basic scientists are there, a broader range of scientists are there to learn from what we're finding in the disease, learn from what we're finding in this powerful sequencing technique to take back to their various laboratories and again further develop new approaches.
So there are other research trials or clinical trials at Rutgers Institute that would have applications towards pancreatic cancer?
Yes, the precision medicine, as we've just discussed.
Right.
We have, based on our associations with the pharmaceutical industry in New Jersey, which is obviously a strength, and the National Cancer Institute, we also have a panel, a growing panel of early stage drug development trials, phase 1 trials, that are quite relevant.
How's the response by patients when you say that you want to do a clinical trial on them? Are they sometimes cautious, receptive? I
think increasingly they're very receptive. When the trials are discussed with the patients, they are given a very clear understanding of the positives, the potential side effects, and they really wrap their arms around it.
That's good. That's encouraging. You mentioned genetics. Genetics. Maybe you can explain to our audience is how much of a role genetics plays, like, for example, myself or Kevin, where we both lost one of our parents to that. What's the risk or the percentage of people that have a family member for us to get that pancreatic cancer?
The familial form of pancreatic cancer is fortunately quite rare, but it does penetrate through a particular family. For this reason, when familial associations are identified, that adds to additional surveillance. additional studies, additional scans to be more vigilant for the additional members of the family.
I see. Kevin, you've had much experience in raising funds for organizations, for clinical trials, because you were the founder, or are the founder of the, and with your father, and you're the president of the Central Jersey Spinal Cord Association. And maybe you can explain why is it so important to raise funds for research?
Well, because if we don't raise the funds, the government is limited as to what they're going to provide to the researchers. So individually, collectively, in our case with spinal cord research, we raise the money, and again, we're lucky here in New Jersey to have Dr. Wise Young at Rutgers, who is thought by many to be the foremost expert on spinal cord research. And the money that our organization raises goes to Dr. Young's research. So it says a lot about Rutgers to have the Cancer Institute here in New Brunswick, Dr. Young at the Bush campus. So our organization and organizations all over the country raise money for spinal cord research in the hope of finding a cure. And again, there are clinical trials that are being done, and Dr. Young is trying to bring those trials here to the United States. They're being done overseas, and he's working collaboratively with those scientists to get that done over here. And hopefully, in the very near future, they'll be doing that for people with spinal cord injuries. And
you brought up a good point where we can't just rely on government funding for research, because we're always hearing about budgets, budgets, budgets in Washington or in the state of New Jersey. And that's why it's so imperative for us as individuals to take that step and encourage people to get involved and to raise awareness and also to raise funds. And through your organization, maybe you can explain some of the, have you seen results through your fundraising?
Sure.
In research? Again,
we deal with Dr. Young because he's right here in our backyard, and he has an open house the first Friday of every month over at his lab on the Bush campus, and we can see firsthand. And Dr. Young leads these open houses and explains to all of us who attend, exactly what's being done and where they are and how close they are. And he talks about the clinical trials in the other countries and where they're going and how far they've been advancing. So what we thought was impossible 35 years ago is now becoming quite possible. And little by little, they're figuring out exactly what needs to be done. And I think the same would hold true with pancreatic cancer research. Little by little, they attempt different things. And I leave the science to the scientists, but we have to have faith in them that they will one day find a cure for what we thought was impossible.
We're having a pancreatic cancer softball tournament. Do you think it's important? Maybe you can explain briefly why is it important to have other types of functions to raise funds?
Well, there are people who like to, run 5Ks or walk 5Ks. There are people who like to do, like to play softball. Our organization has a golf outing. There are a lot of people who like to golf. So by expanding this to, other areas of exercise, if you will, I fully expect to have a team in that tournament. So again, and I don't think it's a competitive type thing. It's there just to have fun and raise awareness and raise money. And again, it's another way for people to participate and help in any way they can.
Yeah, I was going around the park where the tournaments were being held last year, and there were a number of teams that signed up, and it was amazing how they were involved. And what was interesting also was that there were people that were playing softball that may not have played on a regular organized team or tournaments before, but they were involved because they had someone they knew or a loved one that had pancreatic cancer. So yeah, I certainly believe and I advocate for various types of fundraising events to have to encourage more people getting involved, and obviously raising funds and awareness. And so you're offering a challenge that you're going to have more people on your 5K walk team, and you're also offering you're going to have a softball team as well?
I coach a softball team in New Brunswick, co-ed league, and I certainly hope to have that team participate in the tournament. So we will be competitive in the softball tournament. I'm not sure how competitive they'll be in the 5K run, but again, I think that the nature of these events are such that whatever level a person is with running or walking or even playing softball, just the chance to participate and be part of this is really what's the important part. So
Great.
I think it's open to anyone who wants to be involved and cares about this at whatever level they might be.
The Middlesex County Board of Chosen Freeholders is proud to join the Chronic Disease Coalition of Middlesex and Union Counties and the Edison Municipal Alliance in sponsoring the Pancreatic Cancer 5K Run and Walk this year. I will be at the walk with my own team, walking in memory of my mother. I hope our discussion today has inspired you to sign up for our walk or our softball tournament or both. Our hope is that public awareness of this disease will help to raise interest in providing funding for research so that new and more effective treatments can be found. Those facing this disease and their families need to know that they are not forgotten and that we will strive toward making an effort to support a cure for this disease. I wish to thank Dr. Lattime and Kevin Hoagland for joining me in this important discussion and sharing their thoughts, and for their contributions in making Middlesex County a healthy and safe place for all residents. Thank you for watching this month's edition of Spotlight on Middlesex County.